So I'm a private practice urologist in practice in Northern California, in San Ramon. 2 years ago, I became really interested in GAINSWave, and I started doing GAINSWave on my patients for erectile dysfunction and for Peyronie's disease, and I've had some great results. I do a lot of clinical research. I have 5 IRB-approved clinical research trials. I develop supplements for Affirmed Science, and I'm in private practice in Northern California. I'm also the Director of Clinical Excellence for GAINSWave, and I work with GAINSWave on trying to improve clinical protocols. At a cellular level, the way that GAINSWave works is through low-intensity shockwave therapy. So you generate microscopic injuries in the penile tissue, and what happens is your body generates a healing response. And as part of that healing response, your body grows new blood vessels. It does this by activating stem cells, by causing the release of vascular growth factors, and by inducing endothelial nitric oxide synthase, which increases the amount of nitric oxide, which helps open up blood vessels. All this results in an increase in blood flow to the penis. Now, the way that it works clinically is that you come to the office and the physician or their representative uses what looks like an ultrasound device and runs that along the shaft of the penis on both sides and also along the perineum to cause microtrauma of the small blood vessels going to the penis to cause those small blood vessels to become larger. But the way you know you're a candidate is by going to gainswave.com and looking for a provider. All the providers are trained on the latest and greatest in sexual medicine, and you sit down with your provider and talk about erectile dysfunction, because erectile issues come in all shapes and sizes, not one size fits all, and some patients are appropriate for GAINSWave and some patients aren't. Men with more neurogenic erectile dysfunction, like type 1 diabetics who've been diabetic for a very long time and have neuropathy where the nerves don't work all that well, or men who've undergone radical prostatectomies where the nerves are severed, those men have a slightly different problem, and GAINSWave isn't going to help them. Now, GAINSWave works well for men with vasculogenic erectile dysfunction, which is a vast majority of patients with erectile dysfunction, and GAINSWave will work well for them. That's the beautiful thing about GAINSWave, is there are really no side effects. I've treated hundreds and hundreds of patients with thousands and thousands of treatments, and I've yet, knock on wood, to see any significant side effects, negative side effects of the treatment. It's more about commitment of time and financial resources, but in terms of negative effects, there really are none. Initially, it was controversial if it actually works, but I can tell you from my own experience that in properly selected patients, it does definitely work, especially if you add a nitric oxide boosting supplement like Affirm from Affirmed Science. It really does work. Those two things work synergistically. So when you think about erectile function, there's the signal and then there are the pipes. So it's important to boost the signal to the penis, to basically the blood vessels, to increase the blood supply to the penis. And the way that you do that is by boosting nitric oxide, and also by potentially taking something called the PDE5 inhibitor. Now, a PDE5 inhibitor is something like Viagra or Cialis or Levitra, or their generic equivalents. And so the way that a nitric oxide booster works is it increases naturally a substance called cyclic GMP. And cyclic GMP then goes on to open up blood vessels. The way that a PDE5 inhibitor works is by blocking an enzyme that's only present in the penis called PDE5. And PDE5 breaks down the cyclic GMP into an inactive form and closes blood vessels. But if you block the action of a PDE5 inhibitor with something like Viagra, sildenafil, Cialis, tadalafil, vardenafil, Levitra, then you selectively shunt blood into the penis. But a combination of a nitric oxide booster and a PDE5 inhibitor will boost the signal. Now, if you have lousy pipes, it doesn't matter what the signal is. And if you have a lousy signal, it doesn't really matter what the pipes look like. So something like a nitric oxide booster and a PDE5 inhibitor work on the signal, GAINSWave works on the pipes. And the way that it works on the pipes is when you generate this inflammation, which generates a healing response. That healing response is responsible for creating new pipes or blood vessels and opening up the pipes that you have to increase the blood pressure into the penis. It really depends on your health coming in. And so say you're a 52-year-old gentleman who is beginning to take Viagra because erections aren't what they used to be, and a couple times you've lost an erection in the middle of intercourse. You may need 6 treatments, and you may need to come back once a year for a couple of maintenance treatments. That will basically prevent you from needing erectile dysfunction medications again for another 5 or 10 years. Now, say you're 65 and you've been taking Viagra with some success, and now all of a sudden things don't seem to be working as well anymore. What you could expect from GAINSWave is if you take a nitric oxide booster like Affirm and you're taking Viagra or tadalafil, you would probably need around 9-10 GAINSWave treatments. And that would get you to the point where with a PDE5 inhibitor and with a nitric oxide booster like Affirm and with the GAINSWave, you're able to get a really good erection with a PDE5 inhibitor. Now, if you're not taking a PDE5 inhibitor, it might be hit or miss without a medication, but you'll certainly do a lot better than you were before. And if you're a 75-year-old man and Viagra's not working anymore for you at all, a combination of a PDE5 inhibitor and a nitric oxide booster and 12 treatments of GAINSWave with follow-up every 3 to 6 months with some additional treatments, that will get you to the point where you can function. You may not function like you were when you were 20, but it can get you back to the point where you can be sexually active without using a penis pump and a ring, or without injection therapy, or without a penile implant. So it's really a natural way of restoring erectile function for men who want to live life to the fullest and continue to enjoy physical intimacy into their 60s, 70s, and even 80s. I mean, I have patients who are in their 80s that are doing great with GAINSWave. You can go to the gym and work out like crazy for 6 weeks, and after that you'll be in pretty good shape for the next 6 months. But if you don't go back to the gym and you're just a couch potato, then things will not work out so well for you. So the occlusion of blood vessels and the reduction of blood pressure into the penis is something that in all men slowly declines with time. And so just like you go to the gym to keep in shape, you go and use a nitric oxide booster like Affirm, or you take a PDE5 inhibitor, or you do GAINSWave, or a combination of the 3, which I think is the best, to keep your penis in shape. That's what you have to do to keep in shape. The earliest harbinger of erectile dysfunction is the loss of nighttime erections. So men get 3 to 6 erections every night, and they last between 5 or 10 minutes. And the purpose of that is to keep our penises healthy. So have you ever seen the TV show Naked and Afraid? A young, attractive woman who's a survival expert and a young, attractive male who's a survival expert, and you throw them in the middle of the jungle in Belize or the Amazon, and you take all their clothes off, and they each get like one tool, like a machete and something to start a fire, and then you see what happens after a month. Now, you've probably watched a number of those episodes. It's a really interesting show. Have you ever seen the 2 contestants being physically intimate. And so the earliest harbinger of erectile dysfunction is when you begin to lose penile erections at night. And so you're not waking up with a morning wood. And so that's the time where you really should begin taking a nitric oxide booster. That's a really super easy way to get your penis back into the habit of getting erections at night. But say you don't do that, and say you don't take a PDE5 inhibitor, and say you don't do GAINSWave to grow the new blood vessels on the penis, well, you're going to lose nighttime erections, and pretty soon you're going to lose daytime erections. You know, there's no guarantee that you're going to be able to have sexual intercourse for the rest of your life. And so, and if you don't use these amazing new technologies, it's use it or lose it. And, you know, say you're divorced and you're 62 or something like that, and all of a sudden you have a new love interest, but things aren't going to be working for you. And so it really is truly a use it or lose it type situation. If you don't bring new blood flow to the penis, you're going to get fibrosis of the tissue on the inside of the penis, and you're going to get stiffness of the collagen and elastin in the tunica, which is the inner lining of the penis, and it becomes more and more difficult to get an erection. There's something about the penis that allows it to trap blood in the penis, and that's where you get a rigid erection. You don't get a rigid erection just by increasing blood flow into the penis. What actually happens is that there are veins that are on the periphery of the penis, on the outside of the tunica. And as the blood pressure increases in the penis, what happens is it squashes those veins and it blocks the return of venous blood back into the circulation. And that's when you go from a full penis to a rigid erection. And that's really what we need to focus on, is what can we do as we age to generate enough blood pressure on the inside of the penis to block the venous return of blood back to the body. Because the penis is the only organ in the body that moves entirely based on blood flow. And it's the only organ in the body that has skin, but no muscle. So it entirely depends on the amount of blood flow that we can get into there. Now, if you've lost nighttime erections and you have to waste some of that blood pressure on stretching the penis, or you have to waste some of that blood pressure on perfusing fibrotic spongy tissue, then you won't have enough blood pressure to create that rigid erection. And so once you stop getting erections at night, it's downhill pretty quickly from there. Providers love carrying supplements from Affirm Science. So we actually have 4 supplements. One is called Affirm, watermelon extract, beet extract, and ginseng, and Murapawama, which is called potency wood. And they're very strong nitric oxide boosters. So nitric oxide was discovered in 1998 in a lab at UCLA. And it's really the science behind how blood vessels open up. And as we age, the amount of nitric oxide that our bodies produce declines. And so circulation everywhere declines. And so elite endurance athletes will take nitric oxide boosters to boost in performance. Men and women over the age of 60 should take nitric oxide boosters to improve cognitive performance and how you think. And anyone who's interested in erectile function, whether it's penile erection or clitoral erection in women, should be taking a nitric oxide booster. Now, the beautiful thing is it decreases your blood pressure about 4 or 5 points, and there are no side effects of these supplements. So it's really a no-brainer. You can go to www.affirmscience.com and order nitric oxide boosters from there. We also have a supplement called Prelong, because premature ejaculation is present in a quarter of men between the ages of 20 to 50. And this is the only supplement that's specific for premature ejaculation in men. And then we also have a supplement for boosting testosterone levels, which includes DHEA. DHEA is a testosterone precursor, right? So it's a molecule that's broken down into testosterone. Just like you bring iron ore to a steel mill to make steel, your body has DHEA that it breaks down into testosterone. Now, the thing is, it also breaks it down into estrogen, because testosterone and estrogen are very, very similar molecules. And so if you bring in too much DHEA in a man, you might make too much estrogen also, but it also has something called DIM. And DIM is what's called an aromatase inhibitor. It blocks the conversion of testosterone into estrogen. And then support also has ashwagandha and tonkat ali, which have also been shown to boost testosterone in men. And then the final supplement we have is called spunk. And spunk is for prostate health, which has beta sitosterol. It's got pygium, it's got pumpkin seed extract, it's got flax, it's got zinc and magnesium, all things that have been scientifically proven to improve prostate health. And so go to Affirm Science at affirmscience.com, and there are educational videos. I love, as you can tell, I love educating patients. I love educating physicians. I travel around the country teaching GAINSWave and teaching about sexual medicine. I have courses on Teachable. I've just lectured to the large Urology Group Practice Association on new techniques in sexual medicine. So I'm always running my mouth about these things because I think it's really important for quality of life for a man and a woman, a family, in terms of boosting physical intimacy.